Hi everyone! Welcome back to my channel. It's me again, Mama RN, and I'm a mom and an RN as well. So, kung di ka pa nakasubscribe sa channel ko, please subscribe. Please like and subscribe. Yan. So, for today, ito na yung kinaabangan natin na video ko about endoscopy. And alam ko na marami sa inyo ang interested to know more about endoscopy. Okay, so magwa 1 year na ako soon in endoscopy, and alam ko na napakatagal. May nagtanong pala sa akin before anything else. There's a lot of information about endoscopy, so I will divide it into segments na lang, no? So para hindi salok-salok at hindi tayo 1 hour na nag-uusap dito, no? Okay, so may nagtanong pala sa akin how long ako nagstay sa med-surg before I moved to endoscopy. So, I stayed in med-surg for about a year before I decided to move. So, dun sa mga talagang nagpa-follow na sa akin, lagi ko to sinasabi na in my career, I always do assessment every year. Okay? In every year, I always ask myself, ito na ba yung gusto ko? Masaya ka ba dito sa unit? Ito ba yung gusto mo pagtanda mo? Why 1 year? Why Mama RN? Why not longer than 1 year? Kasi guys, ayoko magsayang ng oras. Ayoko magsayang na, okay, let's say I stayed for like 3 to 5 years in that unit, and then kahit alam kong hindi siya for me, or kahit alam kong ayoko na magtagal sa ganung unit. Okay? Kasi sayang guys, sayang yung time. Ako laging ganon in every aspect. What good thing in nursing is marami tayong opportunities. Opportunities for nurses is not just for bedside. There's a lot of opportunities. Pwedeng bedside, pwedeng procedural, or pwedeng remote, 'di ba? So, why not ikutin nyo until mahanap nyo yung niche nyo, yung gusto nyo talaga, hindi yung nagsasayang kayo ng effort and time, di ba? Na hindi nyo pala siya gusto. Alam nyo hindi nyo siya gusto. Unless hindi pa kayo makadecide na, hindi ko pa alam kung ito ba talaga yung gusto ko, then you have to stay until you figure it out na ano kaya yung gusto mo, di ba? So, ganun ako. It's me. Ewan ko sa inyo, di ba? So, yun lang, na-share ko lang. What else? So, ayun, let's start with endoscopy. In endoscopy, guys, there's 2 types. So, endoscopy is under periop, OR, yun lang namang alam natin, di ba? And in nursing schools, hindi naman tayo laging na-rotate sa endoscopy. Wala nga siyang separate, topic na tinuturo about endoscopy. Ewan ko lang sa school ko, ewan ko sa inyo, pero sa school ko, wala akong na-experience na nakafocus sa endoscopy. Naaral naman natin what is endoscopy, di ba, ganyan. Pero yung talagang nag-duty ka sa endoscopy, never ako nakapag-duty sa endoscopy. Based lang sa mga na-research ko until naisip ko na, I wanna try yung ganun. Kasi I started again in dialysis, so it's procedural, no? So, sabi ko, parang hindi talaga for me. I gave chances sa sarili ko na mag-bedside. When I left med-surg, nung nag-start ako kay endoscopy, nag-PPRN ako with rehab, inpatient rehab. So, it's kinda med-surg, step-down med-surg, diba? Pero, sabi ko sa sarili ko, hindi talaga siya sa akin for me ng pangmatagalan. Yung bedside, no? Or siguro dahil matanda na ako, or hindi lang talaga siya for me, yun. Ayoko lang yung kapag nagkulang na kayo ng staffing, ganyan, yung parang problem to ng management, pero tayo ang sumasalo to give solutions, diba? Anyways, so let's start with endoscopy again. So endoscopy, there's 2 types. Ambulatory setting, which is the outpatient, and the inpatient, which is the hospital. Okay, endoscopy is guided or under the SGNA. hindi siya under nung CNOR ng mga OR nurse, kahit under ng peri-opsy endoscopy. Okay. Hindi siya as sterile as OR, yung settings ng endoscopy, but there are some hospitals with other, say, meron kaming pain management na medyo sterile doon. Okay. What else? Anong difference ng ambulatory setting and the inpatient type of endoscopy? So, sa ambulatory, guys, it's an outpatient surgical setting. So, kunyari, ang good thing kasi dito, guys, sa US, once you reach 45, you have to do screening for colon cancer. Okay, binaba na yan to 45. Before it was like 65, then 50, then naging 45 na this time. Okay? So, sa atin kasi guys, pag wala tayong nararamdaman, hindi natin kailangan sa Pinas. No? Unlike dito sa US, guys, once they reach 45, all of their doctors or their PCPs, primary care physicians, are recommending to do screenings, colonoscopy, ganyan. No? Regardless if you have history or not. But that's the guidelines that as soon as you reach 45, you have to do the screening, and then it depends on the result kung when will be your next screening, diba? So, dito talaga, maraming pasyente na nagpapascope. Okay? So, ambulatory, if it's just the simple screening and wala ka masyadong comorbid, you do the outpatient or ambulatory. Your doctors will recommend or i-accept ka nila for ambulatory settings. Pero if ikaw yung pasyenteng marami kang comorbid, marami kang history of cardiac problems, and etc., they usually recommend you to do the colonoscopy in the hospital settings. Kasi once na may nangyari sa'yo or kailangan ng general anesthesia for you, mabibigay yun sa hospital settings. Okay? So that's the difference nung ambulatory and ng hospital settings. Another difference ay sino yung team, ano yung nagko-comprise nung procedure na kinikater nila or services na binibigay nila dun sa settings. So, in ambulatory or outpatient, guys, they only do endoscopy and colonoscopy. They work Monday to Friday. They don't have calls or on-call kasi it's an outpatient. So, they're not expecting any like emergency cases kasi if there's an emergency cases, you have to be in the hospital, di ba? That's the good thing with the ambulatory setting, no? Parang tinatawag tayo ng ambulatory dito, no? Now, let's go to the hospital or inpatient, which is doon ako nag-work sa hospital. No, with hospital or another thing with the ambulatory, guys, with required training, nurses can provide the conscious sedation for the patients under the procedure. Okay, so yun yung sa ambulatory, and then pre and post recovery. Now let's go to the hospital. With the hospital, different hospital has different services, diba? Nasabi ko nga sa inyo, hindi lahat ng hospital ay endoscopy, colonoscopy lang. There are some hospital which has a lot of different procedures too that they cater under the endoscopy unit. So, like our hospital, we cater endoscopy, colonoscopy, bronchoscopy, pain management like nerve blocks, rhizotomy, RFAs, what else? Motility lab, or yung mga Bravo capsule, or the video capsule, or endoflip, something like that. Those are the services that we cater. There are some hospitals na nalaman ko, they cater even yung mga TEE, yung sa cardiac. Cardiac procedure to eh. So, hindi ako familiar with how they do it, but meron lang akong hospital na nalaman na part of the endoscopy unit ay they do TE, balloon, parang ganon, that's for cardiac. Okay? insertion of mga Corpac or mga NG, J-tube, sometimes we do it there as well. Not all the time, but mga changes lang, pag-change ng tubes, we do it there too. Okay. And then the hospital, we work Monday to Friday. It depends on sa oras. Sa oras, may 10 hours. Wala kaming 12 hours kasi usually yung unit ay open lang ng 5 to 5 up until 5 p.m. Meron lang mga on-call. Okay, call shift is kung kailan close yung unit, yun yung mga call shift. Okay, so yun lang yung medyo cons na masasabi ko in endoscopy. Kasi kung konti lang kayong staff, enough lang yung staff, tapos kayo lang yung maghahati-hati with the call shift. Okay, so medyo marami yung call shift. Call shift, technically, hindi siya masyadong problem if emergency cases lang talaga yung gagawin sa mga call shift. Yung tatawagan kayo na we have emergency case na kailangan natin gawin, that's your call shift. Okay, bayad naman kayo habang nag-aantay kayo. And you don't need to like stay there for certain hours kung tapos na kayo sa procedure. And usually pa isa-isa naman yun. No, yan kung emergency cases lang talaga yung itinawag sa inyo. But the cons is there are some call shift na hindi naman emergency. Lalo kung teaching hospital ka, meron kayong mga fellows na kailangan matuto. So sometimes, pag pinapasok nila doon yung mga calls, no, kumbaga yung call shift nyo, instead na nag-aantay lang kayo sa bahay for emergency cases, minsan nagiging parang scheduled na may pasok kayo the whole time na on-call kayo. No? That's the other side na hindi ko gusto na nangyayari. No? It depends on your management. There are some endoscopy unit na meron daw silang weekend team. Yan. So, ang ganda no? May weekend team sila, tapos may number of call shift lang daw sila. So, thank you sa nag-share sa akin noon about dun sa situation ng kanila. Ayan. So, yun yung sistema ng endoscopy. Uniform-wise, we don't have scrub. Ang scrubs namin ay the hospital provided scrubs. So, nagpapalit kami may locker kami, naka-locker kami together with the OR folks. Break room, share lang din kami with the OR and the PACU. So, the whole unit of peri-op ay endoscopy, recovery or the post-acute PACU side, pre-op, and then, or the OR staffs. What else? Hindi kami sterile. Endoscopy, colonoscopy, hindi sterile. Bronchoscopy and pain management are sterile field. Okay. We also rotate sa pre-op and recovery. So we do pre-op, post-op, then procedure rooms. We do scrubbing, circulate, and then same with the pain room, scrub and circulate. Okay, so nagro-rotate kami doon. Training-wise, we did 3 weeks. Kung wala kang experience, 3 weeks for each phases or each pre-op, recovery, rooms, or scrub, circulating, and then pain. Yun, 3 weeks ang training namin doon. And yung 3 weeks, guys, ay enough talaga. Kailangan yung bigyan, wag kayong, ang tagal naman ng training. Hindi, guys, kasi once you move to a procedural, expect nyo, guys, na para kayong new grad ulit. No, na wala kayong, ibang-iba siya, guys, kahit experienced nurse ka na sa floor. ay ibang-iba siya sa procedural. Pero ako, siguro, mas sanay lang ako ng procedural kasi sa dialysis is a procedural too. Sanay ako ng patient ay in and out lang. And for a short period of time, hindi mo sila hawak ng matagalan. And then, ayun nga, matatapos yung may average time lang na andun kayo. Kumaga, hindi siya 100% patient care. Unlike sa bedside, 100% patient care. With endoscopy, kung nasa pre-op, post-op ka, ayan, andyan yung interaction with the patient. Kasi, ikaw ang mag-history, mag-insert ng IV. Don't worry guys, gagawa ko ng separate routine or day-to-day or ano yung ginagawa talaga sa endoscopy for the whole shift, saying like that. But ayun nga, patient care-wise, pre-op and recovery, andun yung patient care, 100%. No? Pero hindi kasing tagal ng sa bedside na hanggat hindi pa nadi-discharge yung patient, sa'yo pa rin. With doing rooms or scrub or circulating, siguro nasa 30% na lang ang patient care dyan, more of teamwork. Even sa pre-op and post-op, it's always teamwork. So what I like in procedure room, guys, kasi in bedside, it's supposedly teamwork din naman doon, no? Pero madalas kasi na individual pa rin dahil pasyente mo lang yun yung ganun. Unlike dito sa procedural, it's teamwork kasi, especially sa rooms, hindi lang nakasalalay sa'yo as circulate or sa'yo as scrub yung success ng isang procedure. Turnover of the rooms, turnover ng pasyente, yung bilis ng pag-assist mo sa doktor, lahat yon ay teamwork. And 30%, kaya ko lang nasabing 30% kasi guys, once na nasedate na yung pasyente, syempre tulog naman na sila nun. Procedure na yung gumagana doon, no? So, yung 30% na lang doon yung pagpasok ng pasyente at paglabas ng pasyente. Okay? What else with endoscopy? Ang tanong ay, I like it ba or not? I like it better in endoscopy rather than doing bedside kasi sa whole day mo, expected mo na kung magiging busy ba kayo o hindi. Kasi alam mo na kung how many cases yung gagawin niyo for the day. May ilan ng mga add-ons for the hospital na ginagawa. So, ang ginagawa kasi namin, scheduled cases is in the morning and then afternoon yung mga add-ons like for inpatient, kung may mga inpatient na kailangan ng mga scopes or ng procedure, doon ginagawa. What else? I like it there kasi no work during weekends, no work during holidays, and day shift lang, no, walang work at night. So, it's been a while na hindi na ako nagna-night shift. What else that I like here? It's routine. Once you know how to do it, it's gonna be easier for you. And sobrang konti lang yung percentage na yung mga hindi mo ine-expect. Yung mga hindi mo ine-expect na pwedeng mangyari. And usually, sa mga recovery yan. Pag nagre-recover na kayo ng patient, kung walang magiging problem along the way. But mostly, I always, alam mo na kung ano yung i-expect, ganyan. Okay? Unlike sa bedside kasi guys, since hawak mo nga sila ng 12 hours, you don't know what's gonna happen in that 12 hours. Everything and anything can happen in the 12 hours, right? And then, it's 24/7 service sa bedside. Kahit holiday, may pasok ka. Day and night. So, it's like sa bedside, ikaw yung executor. and management of the patient care, di ba? Sa procedural naman, or dito sa mga procedural units, ikaw ang dapat na team player. So, it's a teamwork. You assist the doctor, you assist the patient. So, for those naman na nagtatanong na hindi nasa healthcare, no, bigyan natin sila ng explanation dito, guys, ha. Alam ko naman na majority na manonood dito ay nurses, but may nagtanong kasi na kung anong ginagawa sa endoscopy, ganyan, and ano yung bedside and procedural unit. Bedside, ito yung mga med-surg, ICU, pediatric ICU, NICU, step down. Ito yung mga, ikaw yung nurse, may pasyente kang hahawakan na naka-admit at i-discharge, ganyan. So, procedural naman, ito yung mga cath lab, dialysis, endoscopy, OR, PACU, or recovery nurse. Yan naman ang mga procedural units. Ayan. Okay, guys. So, yun yung overview of endoscopy and how it is here. And sa next segment ko I'm gonna talk about yung anong ginagawa sa day-to-day sa isang endoscopy. Okay? Thank you!